Hello, my name is Chad Nicholson. I'm a second-year cardiology fellow at Ascension Providence Hospital, and my abstract is titled A Sign of Disparity, the Underutilization of Novel P2Y12 Inhibitors in ST Elevation Myocardial Infarction Following Percutaneous Coronary Intervention. I have no disclosures. The objective of this study is to investigate which P2Y12 inhibitors were being prescribed in two Metro Detroit hospitals among patients undergoing PCI in the setting of ST elevation myocardial infarction and identify potential gender, socioeconomic, or ethnic disparities. The treatment of ST elevation MI, and specifically the use of newer generation P2Y12 agents, has evolved over the past 20 years. With the greater efficacy of ticagrelor and prasugrel, there has been a gradual shift in prescribing habits among interventional cardiologists as the most recent available guidelines from ESC and ACC all favor prasugrel and ticagrelor over clopidogrel in the setting of ACS. However, as with all new medications, their uptake has not been uniform, and in some cases there has been a reluctance to prescribe these medications based on their cost concerns and associated side effects. There are also socioeconomic factors that guide prescribing patterns, which have been demonstrated in prior studies. We therefore sought to investigate which P2Y12 inhibitors were being prescribed in our community hospital setting upon discharge among patients undergoing PCI in the setting of ACS, specifically ST elevation MI. Our main objective was to determine a gender disparity, commercial versus non-commercial insurance disparity, and a possible ethnic disparity. So we identified patients presenting to two Metro Detroit, Michigan hospitals with ST elevation MI between January 1st, 2018 and December 31st, 2021. And this was using Blue Cross Blue Shield of Michigan Cardiovascular Consortium PCI registry. The primary outcome was the choice of P2Y12 inhibitor prescribed at the day of discharge following index hospitalization and PCI for ST elevation MI. Compared demographic characteristics including sex, race, as well as type of insurance were looked at. Baseline characteristics were compared using chi-square tests for categorical variables, analysis of variance for continuous variables, and logistic regression to assess the association between sex, race, and type of insurance. As for the results, we had a total of 366 patients that presented to these two Metro Detroit hospitals between January 1st, 2018 and December 31st, 2021. Most of these patients were white, 66%, and male, about 70%. Most of them had associated comorbidities such as hypertension, dyslipidemia, and diabetes. We found that patients that presented to the hospital for ST elevation MI and had PCI to the culprit vessel were more likely to be discharged on clopidogrel about 51% of the time than ticagrelor or prasugrel, which was 34% and 14.5% respectively. To assess for the primary outcome of the study, the ticagrelor and prasugrel groups were combined, as the guidelines don't give preference over one of these more potent P2Y12 inhibitors. So we found, if you can look on the left side, we found that white patients were more likely to get ticagrelor or prasugrel than the non-white counterparts. And if you look on the odds ratio graph here, you can see that although the confidence interval does cross 1, there is definitely a trend that the non-white patients were more likely, 1.4 times more likely to get clopidogrel than the white patients. And when we look at gender, so the male patients were more likely to get ticagrelor or prasugrel than the female patients. And you can see here on the odds ratio graph that the female patients were 1.5 times more likely to get clopidogrel than the males. And this confidence interval fell at 0.99, so not technically significant, but definitely a trend here. And then when we look at insurances, our private insurance patients were more likely to get ticagrelor or prasugrel than our non-private insurance patients. And this did reach significance. If you look at the odds ratio graph, we have non-private insurance patients were 1.8 times more likely to get clopidogrel than private insurance patients. So in conclusion, the newer, more potent P2Y12 inhibitors are being underutilized despite our updated ACS guidelines by ACC and ESC. We demonstrate a clinically significant disparity in prescribing patterns based on insurance, gender, and ethnicity, and more studies should be performed to find ways or opportunities to eliminate these disparities.